Recording in progress.
So welcome everyone to the Network Lead Entity Community Care Hub CCH meeting for April of 2023. If you're entering in, if you could please mute yourself and put your agency name after your Zoom name. We have an exciting day today. We are going to be having a presentation from Meals on Wheels of Central Maryland. Margot Carusi, the Senior Director of More Than a Meal Services, will be presenting about some food insecurities. I do want to screen not advancing. Okay. Remind everyone about our grant goals and also share some information of some additions that we've made over the last couple of months to our website. We are to integrate a statewide system to support access, sustainability, and participation in a variety of evidence-based behavior change programs. So if you haven't been to our Living Well website, I encourage you to do so. I am sharing the hub screen right now, and I want to make sure that everyone can see that. Is the calendar of workshops. So we have established some statewide workshops that are going virtual to help and assist agencies across the state that are having issues with implementing evidence-based programs. So if you have clients that would benefit from chronic disease self-management, diabetes self-management, we have a variety of caregiving programs available for registration. Please encourage them to utilize the site. It's very easy to sign up. Registration is taken right online. And I am going back to the PowerPoint. We are also in the process of implementing a standard screening of social determinants of health needs to be used across CBOs and providers. We're utilizing a screener in some of our dementia workshops right now. We're also establishing a multicultural agency network to create that reimbursement learning collaborative for AAAs and community-based organizations. We are working with a variety of hospitals across the state, Maryland Primary Care Program and CRISP, to document these return on investment and improve quality of life for older adults with disabilities in the work that we're doing. And we're also leveraging existing contracts to pilot a reimbursement models to lead to that sustainable funding. So if you are new to the Hub NLE meetings, I encourage you to visit mdlivingwell.org. We have had presentations over the last year on heart funds and CRISP and MDOA, a variety of billing opportunities, housing, dementia. Let me see what they have here. Share. Sorry. Share. Here we go. So these are, this is available for you to view, to download resources. There's the PowerPoint presentations from a variety of presentations that have been made, and a recorded recordings of the network lead entity meeting. So if you want to go back and pick through and see if there's of interest to you, if you are new, please utilize this resource. I am going to turn this back now over to Margot Carusi, and she is the Senior Director of More Than a Meals Service at Meals on Wheels of Central Maryland. She has over 10 years of experience working in the nonprofit field in Maryland, and she has a Master of Arts from Catholic University of America in politics, and her work has use this direct client experience to help develop and implement programs that support clients by meeting their unique needs of individuals and their communities. So her work at Meals on Wheels looks at the entire client population based on the social determinants of health and determines which support and additional services will assist their most at-risk clients in remaining safe and independent in their homes. So I welcome Margot. Thank you for joining us. And I'm going to turn the presentation over to you.
Great, thank you so much, Wendy. I appreciate it. So I'm from Meals on Wheels of Central Maryland. My name is Margot Caruzzi. Like Wendy said, I'm the Senior Director of More Than a Meal Services. And so today I'm going to talk about the meal delivery offerings that we have, but I also am going to go a lot into what we call our More Than a Meal services. And that has a lot to do with what we've been talking about in these NLA meetings, the social determinants of health work, and the way we look at the client as a whole person and everything that it takes to keep them living independently. Next slide. So we wanted to start off, of course, with our mission. What do we do at Meals on Wheels and why do we do it? So our mission is to enable people to live independently at home through the provision of nutritious meals, personal contact, and related services. So we always like to start with this because it does go beyond, I think, what people first think of when they hear Meals on Wheels. So of course, those nutritious meals are the foundation. They're the foundation that all of our clients receive. But beyond that, we're getting into those areas that are the social determinants of health. So personal contact is the first piece of that. Our meals are always delivered in person. And so that could be by a volunteer, it could be by a staff person, a huge driver team that we have here at Meals on Wheels. But that personal contact, that moment of contact, provides a lot of opportunity for those social determinants, opportunities to learn more about the clients and what they need in social areas. And then related services. What do we do about what we know about our clients? So we're out there, we see them in person. What other services might they need? And what related services can we refer them to? And what related services do we do at Meals on Wheels that we can add on to their meal delivery service? Next slide. So this is an image of the area we serve. So Central Maryland. We operate here out of our Baltimore City office, and this is where our central kitchen is as well. So almost all of our meals are prepared right here in our central kitchen in our office in Baltimore City. And then on top of that, we have 20 distribution sites. And those are located all throughout the counties you see here on this map. So we cover Carroll, Baltimore County, Harford, all the way down into Montgomery and Prince George's, and then Anne Arundel and Howard as well. So the reason we have distribution sites is that the meals are made here by our kitchen, and then the distribution sites is where the drivers in the vans that look just like those pictures there bring the meals for the volunteers to come pick them up to get them in the hands of the clients. So we know that volunteers' time is really valuable. We don't want them driving really long distances. So especially if they're volunteering, down closer to Prince George's or Montgomery County, we want them to have a much closer location they can go to. So that those are those distribution sites. They're staffed by a staff person, and then the volunteers go there to pick up the meals. So this is our service area and kind of how our distribution operates. Next slide. Whom we serve. So this is a picture of one of our current clients. And this is painting a picture of what our client population tends to look like. And again, it's maybe a little bit of a bigger scope than people might initially think of. So first it's individuals who are having difficulty cooking, shopping, and caring for themselves. I think it's really important to point out that word difficulty. That can mean many different things. Difficulty can mean difficulty with making a nutritious meal. They might be able to throw together a sandwich, but a nutritious meal, something that's well balanced, would be much more difficult. The next point is are recovering from surgery. So that gets to time frame. So It doesn't always need to be a long-term need. It could be a temporary need. So we might see something like that upon hospital discharge. And that also gets to partnerships that we often have with healthcare entities, knowing that individuals often need additional support when they're discharged from the hospital. Next is when to choose living at home over a nursing home or assisted living. So they might need additional care, but that meal is really going to give them a large part of the support that they need to remain living in their home at least a little bit longer. The next point is so key: help family care for elderly parents. So this is getting at that caregiver piece. And so we have many clients who may live with others, live with their caregiver, but maybe that caregiver works during the day and they know they have the security that our meal's going to arrive. That's going to be an opportunity for contact, for a check-in. And it can be just such a relief to them that that safety check is there, but then also that the additional food that they maybe get some respite from having to prepare. And then finally, if they want to stay at home, it's their choice. Our approach is very client-centered, and so we always want to remember that our clients, our seniors, as people age, they have that agency and they can make that choice. And we do know that they often want to choose to stay at home where they feel safe, where they have, maybe lived a very long time, where they're used to the community, they're used to their home, and it is absolutely their choice to do that. And we want to assist them in living safely and independently. Next slide. So our More Than a Meal services. So this is our trademark, More Than a Meal. The meal itself is, again, that foundation. But we are more than a meal because we know that nutrition is only one of those social determinants that's going to really assist that whole person. And so these are examples of programs that we have at Meals on Wheels that we're able to assist clients with some of these additional needs. I'm going to go through this list here, but some of these individual things I'm going to go into much more detail a little later on. The first one is our grocery assistance program. So this is a great program that matches a volunteer with a client. And that volunteer does the additional grocery shopping that that client needs. We do provide 2 meals a day, but there's always going to be additional nutrition needs, right? Snacks, a third meal of the day. And then another really key part of grocery assistance is they're able to help clients with prescriptions and with prescription pickup. And we know how important that is. And so that's still that nutrition piece, but it's a different model of service, matching one volunteer with one client. And there's a lot of flexibility there in how they determine how often does the volunteer go, how do they share lists, how does the volunteer know what to buy. Once that match is made, they have a lot of flexibility in terms of what it looks like, but we typically see about twice a month is when volunteers shop for their client. The next one is call connections. We will talk more about this one. This is our social isolation program. So this is a volunteer caller and a client. And so they are matched, and it's meant to reduce isolation. It's all over the phone. It's never in person. And is to provide that opportunity to reduce isolation, have a really nice conversation. And we really also think it works both ways, right? It benefits the client. It also benefits the volunteer to have a nice, friendly conversation. The next service is our home repair program. So, and this is one piece of it. It is called HUBs, that some of you might be familiar with, housing upgrades benefiting seniors. And so there are a few different models of our home repair program that I'll mention later. But this program is in Baltimore City for seniors over 65, helping with repairs and modifications. Really wide range of things that are options. It could be something like a grab bar installed at the shower to reduce their fall risk, all the way up to sometimes we're fortunate enough to be able to replace a roof. And we know how important that is to the safety and structure of the home. The next program is our Kibble Connection. This is for pet food delivery. So this again has a volunteer delivering pet food. It's a partnership with the Maryland SPCA, and they deliver that pet food every quarter. And we're able to feed multiple cats and dogs up to a certain amount, and hopefully able to relieve that client from the financial burden of having to pay for that additional food. Part of where this came from is that even in delivering meals, people were seeing firsthand that the client might receive a meal and then be sharing it with a pet. And we really want the client to receive that nutrition. And we also understand, how much they benefit from the companionship of their pets. And so we understand how much they care, and we're really happy to be able to offer that additional service. Next is SNAP screening. Economic security is critical, and we'll touch more on this one as well. We are able to do SNAP screening on behalf of our clients. We are credentialed screeners, and that really also gets at, we know that for our population, many of our clients, might not have internet access, can't as easily go online, might not have the mobility to make it to one of the centers that would help them in person. And so we're grateful to be able to provide that access and remove any barriers they might have. Next is targeted case management. So this is reserved for our clients who we consider to be at highest risk. So these are the clients who potentially may be at risk of not being able to remain in their home. And so we have different assessments and evaluations that we do to kind of see where everyone's at. And when there are clients who not only are at high risk, but who maybe don't have access to any other services. So sometimes someone might be high risk, but we know of another option we can send them to for case management, for in-home care, those kinds of things. But when that's not an option, or we want to monitor them more closely, we have them in our case management program. It's typically intensive contact, working through the care plan to see all the different resources they might be in need of. The next one is another food-related resource. It's called My Groceries to Go. This is a federal program. We work together with Salvation Army, and this is a grocery box. So it's a once-a-month box of shelf-stable food that we are able to deliver. This is a program that is something we can offer as additional food to people who are Meals on Wheels clients, but it's also an option for people who do not receive Meals on Wheels. So this is one of those unique services that is available to people even if they don't receive that daily meal delivery, and they will get that shelf-stable box once a month. And then finally, we always want to point out that we do those external referrals. So anything that we cannot do in-house, anything that we don't have a more than a meal service for, we really work to make those connections. Because again, we know the client might not be aware of the resource or might not know of how to apply for it. And so we're happy to be able to do that for them. And an example would be lots of our clients need some help in the home, whether that's personal care or help with clutter and cleaning in the home. And we're able to make that connection, likely through the Department of Aging or MAP, who we've heard from on these calls. And we're simply able to make that linkage, and then we know that they will take it from there. Next slide. So I wanted to point to some results and impact. So this is for our fiscal year 2022, and this is the number of engagements in each of those programs that I went through. Number of meals served, over 1 million. So over 1 million meals served to our clients. And in that fiscal year, that was 4,695 participants. In terms of our census, as many of us probably experienced, we saw the numbers absolutely skyrocket during the pandemic, which we think really showed a need that was already there. We also know that there were people who needed the additional nutrition and support during that time, but maybe some things have eased and changed, and they didn't need the service, long term, but during, especially the beginning of the pandemic, in order to stay safe, that meal delivery was essential for them. So the numbers really rose to extreme heights. So that has leveled off a little bit, but really our yearly number is still well above where it was trending before the pandemic started. And so again, we feel like it really highlighted the need that was already there. For our home repair programs, we were able to directly do repairs for 51 participants during that year. And again, that was a range of smaller to larger projects. For call connections, 590 clients, participants received calls from a friendly calling volunteer. Kibble Connections served 172 people and 284 pets. So again, pointing to some of those clients having more than one pet. The Grocery Assistance Program is 465 participants. And then our Case Management Program was 38 participants needing that additional support. Next slide. This is some of our impact. So we do surveys of our clients because we always want to see how we're doing. And this is just some examples of the results that we saw throughout the year. And we do try to touch on different things having to do with the impact of the meals that they receive. Able to remain living independently, 95% said yes. Increased income, if we're lucky enough to have a subsidy available where those meals are funded, that's clearly a relief. So 90% said yes to that. Improved nutrition, 91%. Maintained or increased functional mobility, 95% agreed with that. That could be anything from just that additional support and nutrition. It could be the safety and security of having that daily check, makes them feel safer. It could be having a safety modification in the home that helps with their mobility. Overall quality of life, 90% said that was improved. And then last but not least, one we're really proud of is increased medication compliance. 100% of our clients have reported that we help with that. And we truly believe it's the arrival of that meal, that hot and cold meal, because we know how important medication that needs to be taken with a meal. So it's not only that's the safe way to take your medication because now you've eaten, but it's that reminder, it's that trigger that, oh, now it's time to take your medication because the meal arrived. And so we're really, really proud of those results. Next slide. So all of that work that we do, we could never, ever, ever do it without our amazing team of volunteers. We work with over 3,000 volunteers each year, and they are incredible, care so much about the clients, and they can do many of the different programs, most of which we've already talked about. So they can do that meal delivery. They can go to the distribution site and then do that meal handoff to the client. Directly related to that, they can come here to our central office and to our main kitchen and help with the packing of those meals. And that's really, really helpful because we're able to do it more quickly and get more done the more help that we have. And then the programs I already mentioned, you can volunteer with our grocery assistants, call connections, and Kibble Connection program. And we are just truly grateful for their help. It is right now Volunteer Appreciation Week this week. And we gave out certificates of service to clients. I was at a distribution site yesterday, and I gave a certificate to someone for 40 years of service. So he has been volunteering for 40 years. So it is truly remarkable how dedicated they are. We're very grateful. Next slide. So with all that said about the good stuff that we know that we're doing, we also know what the reality is. And we know that there's some numbers that can seem pretty daunting and that point to why partnership is so important, that point to why, CBOs and working with healthcare and all of us coming together is really so important. So we serve a lot of Central Maryland, but majority of our clients are in Baltimore City. And so we always kind of want to keep an eye on where the numbers are there and then any differences in how we direct our focus. So up here at the top left, we see 9% of people in Maryland are food insecure, and in Baltimore City, that number is 15.5%. 17.6% of seniors live in poverty, and again, in the city, that's 16.8%. There is a difference for seniors with disabilities. 13.3% of seniors with disabilities are food insecure, compared with 4.9% without disabilities. And then, as we all know, it's the growth of the population. 85 and over are the fastest growing segment. And Maryland will see a 158% increase by 2024. And so it just points to the resources that are going to be needed, the food insecurity that we're going to continue to see, and how we have to have these things on our radar when we're evaluating how we deliver services. Next slide. So moving to social determinants of health, and it again goes back to our mission. Why do we think about these things? We do nutrition, we know that, so we do one of them, right? But letting someone live safely and independently is about, we think, more than that food. As valuable as the food is, we know that we can do more than that. And so our mission informs this work of offering additional supports. How we know where our clients are at. Wendy mentioned in some of my history, one of the things that is most important to me is understanding the population as a whole. So every single one of our clients receives a comprehensive assessment. That assessment happens when they initially come on service, and then once every single year. And that comprehensive assessment covers a lot of different areas, some of which is required by our contracts. So we do activities of daily living, instrumental activities of daily living, nutrition risk, but then we also use other screenings to cover different social determinants of health to make sure we understand where our clients are at in those social areas as well. And then another really key piece of this, in addition to the assessment, is our client concern reporting system. So any individual, staff, volunteer who has a contact with a client has a way to report client concerns directly to us. And so that can tell us about other needs the client might have. It could be things that a volunteer observes and sees when they deliver a meal. It could be something that a client mentions. So a couple examples that aren't uncommon, delivering the meal, they observe that the railing to the stairs is really wobbly. It's practically broken off. That's definitely something we want to know. We want to keep the volunteer safe, we want to keep the client safe, and you need a sturdy railing to navigate up and down stairs. Something that the client might talk about, they might share that, they've been experiencing some financial burden and they just received a turn off notice from BGE. So they're facing their utilities being turned off. Again, something we really want to know in order for them to stay safe. It's also directly related to meal service, because in order to keep our food safe, they might need to refrigerate it. So we want to make sure the refrigerator is working. They could have health needs where their electricity needs to be on. Our system is connected to the app that volunteers and drivers use to deliver meals. And so we're able to monitor these things in real time. And so as soon as someone types it in the app, we're able to see it and we're able to triage and react accordingly. So we're able to, things that are urgent, respond to right away, and then follow up as needed. But that's been really key to understanding different social areas that people are flagging beyond the nutritional need. Next slide. So I'm going to dig into a couple of the social areas that we work with. It certainly doesn't cover every single one of them that we talk about a lot, but we do cover quite a few of them. The obvious one is home delivered meals. So we deliver food, addressing food as a social determinant of health. Next slide. A little bit more about those meals. I think many people know it's daily delivery. It is Monday through Friday that we deliver the meals. It's one hot meal tray. Most people, we think, eat that hot meal right away because it arrives hot. And then it's a cold meal tray. And that is typically what they might put in the refrigerator and eat a little bit later. We do offer for clients an option of weekend meals, and those are still delivered during the week, but those are frozen meals that they put in the freezer that can be heated up over the weekend. The meals are delivered by volunteer, or it can be staff or driver, between 11 a.m. and 1:30 p.m. And so that window is key too, because it's lunchtime. We figure they might be hungry by then, but then also it's that reliability. It's that they know we're coming at that time, and they know that that's their opportunity to have their safety check. Their family knows we're coming, and they know that we will have checked on them by that time. Next slide. A little bit more about our meals. You can see the pictures, even just from the trays, you can see that the portions are broken out. It's your vegetable, your protein, maybe some carbohydrate, or something along those lines. So all of our meals are low sodium and there's no added sugars. They are designed by a registered dietitian. It meets the nutritional needs of seniors. It actually follows the state standards for senior nutrition. We do have a couple special options. And so some of those, because of the way that they need to be made, aren't made at our central kitchen here. And the two examples of that are, we do have a kosher kitchen. So that is not on site here. It's up in Baltimore County. And so because of where that's located, the service area is around there. So it's a little bit more limited right now. But we are happy to be able to have that offering. And then in Howard County, we have a similar thing, a Korean meal program, where we get that meals from another source and have a distribution site there where it's delivered, but that's a little bit more of a limited service area. We also have another option that's limited just simply because it's a special referral source through one of our healthcare partners, through LifeBridge. And those are meals that have specific diabetic standards. So all of our meals have no added sugars, but this is sort of a different model for that. Choice about meals, is something we're talking about all the time. We know that people have different needs and are interested in variety, and we've made lots of changes. And so we're always kind of keeping that in mind too. Is what are people wanting in terms of the meals, and what do they need in terms of their diet and their health. Next slide. Okay, moving on to home repair. So this is neighborhood and physical environment as a social determinant of health. There's so many things about where we live that are really important for our clients. Our number one priority is fall risk. And so we know the risk of seniors falling in their home and kind of what that can tend to lead to. And so we really want to make sure that the home itself is safe. We've been lucky enough since about 2015 to have a few different partnerships that we work with in order to do home repairs for clients. And so one I mentioned is Hubs, which is in partnership with Civic Works, housing upgrades benefiting seniors. We've also been really fortunate to work in partnership with the Home Depot Foundation. And we have repairs that we're able to do for veterans. So for people who've served in the military, we're able to offer them additional support and home repairs, which is fantastic. And then we've also worked with our great partner, Neighborhood Housing Services, in order to do some home modifications in West Baltimore. Next slide. So this is an example of that. You can see the picture there on the left. Through all of our different programs, we've been extremely lucky. We've had 1.5 million in different grant funding for repairs. A lot of that is directly for the repairs for our clients. This picture is of that new door that we installed. So that was the repair. So that's an example of something that if they weren't connected with us, they might not have thought too much about. But we know that there's a lot about that could be, a safety issue, the security of the home, energy efficiency and drafts around the doors. So having something new and correctly installed. In this instance, it is a client who did live with the caregiver. And when we spoke to her, we wanted to share her quote because she talked about how she loves the service and not having to worry about cooking because she's managing so much else. So it gets back to that supporting the caregiver. She was happy with our construction team. They cleaned up very well, which we were happy to hear. And she commented that it's nice that the vets are being remembered and it's just a great thing that they're doing. And so this is just one example. This is one of the 51 projects that we completed in the fiscal year 2022. Next slide. Benefit screening. So this is our economic stability as a social determinant of health. So as part of our assessment, we do financial screening, see how people are at. We know that even with subsidized meals, if the meals that they receive are free, there's so much more that they're going to need, that their finances are going to be so important towards things like paying those bills, paying those electric bills, paying for their medication. And so we work with both SNAP and with Earn Benefits Online, which is a screening tool that we use. So we're able to do a pretty quick pre-screen and see, do they qualify for SNAP? Do they qualify for utility assistance, some tax credits? And then we're able to complete the applications based on the pre-screening. Next slide. So digging a little bit deeper into SNAP, because we know how important that is for addressing food insecurity, poverty overall. We have a few different ways that we work with a SNAP program. If clients aren't able to get a subsidy and they may not qualify, or they might be full at that time, they are able to pay for their meals with SNAP benefits. Another is that our GAP volunteers, if they're doing grocery shopping, they're able to become an authorized user and to use that client's EBT card. But majority of our work and our work in partnership with SNAP has been that our staff are credentialed screeners. So we complete SNAP applications through our system on behalf of our clients. So we're able to do that over the phone. So that again gets to the clients who might have mobility issues. They can't go to other places that might do that. They aren't able to do it online themselves. And we're able to complete the application on their behalf. And there can be many barriers. There's even documentation requirements in many instances, and we're able to help with those as well. So we completed 41 SNAP screenings for our clients from October 1 to December 31st. That's about typical. We do about 200 per year. We do know, as many of us I'm sure are aware, that as of March, the SNAP emergency allotments have ended. So we became aware of this in many different ways.